It's Anne. Sitting here thinking about different things that I wanted to talk about. I guess I'll talk a little bit about my job. So, and what we do in the hospital and what most hospitals do, or at least I hope most hospitals do, when there is a perinatal loss, when there is a loss of a pregnancy or an infant. And many people, I just wanted to bring it to light because I know that many people don't understand and may have personal feelings about what we do and whether it's helpful or it's harmful or whatever. So I just wanted to talk about some of the things that we do. So when a baby dies in the hospital, most hospitals have some sort of bereavement program. Not all, are as established as others, but there's usually at least a couple of nurses who try to do their best with what they have and try to make, it's hard to say the best out of the worst experience in someone's life, but just to make it more memorable than traumatic. That's really what we're trying to do. And truly, most everything that we do in our jobs in perinatal bereavement comes from other parents who have been there through the years. So, I talked in an earlier video about generational losses and especially infant and pregnancy generational losses that, in my mother's and grandmother's age, we didn't talk about it. Don't talk about it. Put it in the closet. Don't bring it up again. Just move forward and get pregnant again and move on with your life and just get over it. Kind of pull up your bootstraps sort of mentality. So those women did that for a long time. And then a few here and there would say, geez, I really wish, they finally came forward and said, I really wish I could have seen my baby. I never saw my baby. I lost a full-term baby and I never got to see it. How hard was that? I wish I could have held my baby. I wish I still had a picture. I forget what my baby looked like. So from all of these wishes and hopes and dreams throughout the years is how perinatal bereavement programs have started. So we try to honor as much as we can of what the parents may want. So, normally what we do is that we either me or usually the labor and delivery nurses, the NICU nurses, whoever is in touch with the families, will start talking to the families, shortly after they get the bad news. Obviously, once they get the news, it's like always sudden and unexpected, like I've said before. So it takes a while to even process that this is happening, that this is real. But once the process moves along a little bit and they come into the hospital for usually induction of labor to deliver the baby, the nurses will start talking to them about what could happen. So, I always say to them, we have a lot of options and not everything is going to be for everyone. But these options have all come from parents who've wished for these things in the past. So, there's no right or wrong decision to be made in all of this. I tell my parents, this is all wrong. Babies shouldn't die before us. They should far outlive their parents, and that's the way life should go. But it didn't happen that way, so we're going to try to make it the best we can at the time and not make it so traumatic for you and make it as memorable and a positive memory that we can out of this whole traumatic situation. So any decision you make is not right or wrong. If it's right for you, then it's the right thing to do. May not be the right thing for me. It may not be something I would choose to do or the woman down the hall. But if it's right for you, then it's the right thing to do. So I tell all of them, and I tell all of my, couples, if there's a couple, whether it's a mom and a dad or two moms or whatever, that as long as it's okay between the two of you are the only ones that matter. There's going to be everyone else, the family, and everybody's going to have an opinion. Everybody's going to have a thought of what you should do, what you shouldn't do, what's right, what's not right, what's going to hurt you, what's not going to hurt you. You know yourself. So whatever is right for you here and here in your heart and in your mind, then that's the right thing you should do. So I'm going to list everything that we could do, and you can choose none of it. If none of it is right for you, culturally, religiously, personally, whatever, then we do none of it. If you want to do a few of the things, we can do a few of the things. You can change your mind at any time. This isn't something that we write in stone as soon as you come in that say, oh, well, she said she wanted to hold the baby. She said, if you change your mind and, something spooks you, or you all of a sudden have a feeling that you need to do something, then we change our mind. If you want to do everything that we have, then we're going to do everything. We're going to go give you everything that we have. So I give them the options, and we give them to them a few times, because when people are in shock, they don't absorb what you're saying. So, I say to them, their minds have to be spinning like a tornado. We had a lecture last year, actually, at our hospital, from Cherokee Isle, to give a big shout out to Cherokee Isle. Cherokee Isle is a lost mom herself, and she's a pretty famous author of several books on loss, on pregnancy and infant loss. And she came and did a lecture at our hospital. We had a conference, and the one thing that she said that really stuck with me was she kind of emulated in the room. She had everyone in the room. She divided it up into, 4 or 5 groups, and she'd say, pregnancy loss is very sudden and unexpected. You can sometimes compare it to a car accident. Things are going great. You're driving down the road. You're making all these plans. Life is going well. And then all of a sudden, you're hit by a tractor trailer. And the next thing is you're hearing all of these things. So she divides the group up. And the one group makes the sound of an ambulance. So it makes that, they make the sound of an ambulance. This next group is going to say, are you okay? The next group is going to say, is there anyone you want me to call? The next group is going to say, do you want to hold your baby? The other one is going to say, you need to bury your baby. So she has them all talk at once, all 4, 5, 6 groups, whatever she did. She has them all talk at once, and it's all this sound and all these people saying things and whatnot. And to be in that room to hear that was very impactful to me, and I'm sure to everybody else in the room. And you can see, and I realized at the time, that's what I see in parents' eyes when I talk to them, or I talk into a brand new person who is brand new in that raw, brand new announcement of grief. That you can see that their head is just whirling, and mostly with their own thoughts, but sometimes with people saying, well, you need to do this, and we need to go here, and you maybe, are you okay? And so sometimes giving them some quiet can really, really help them. But we try to give them these options. And like I said, they're not hearing us. So we try to give them over and over. And I tell them up front, listen, we're going to tell you these things over and over and over. If they refuse right away, we don't push the issue. We could always revisit it later if they say, could I still do, such and such? But if we feel like it's a cultural or a religious or something like that reason that they're not doing it, then we don't push the issue. But if they seem like they're not sure or whatever, I try to normalize it as much as I can for everyone. I try to tell them that other parents have wished for these things. That's why I'm offering them to you. This has come truly from other parents who've walked in your shoes. So other parents wish they had pictures. They wish they had more pictures. They wish they held them. They wish they held them longer. So that's why we give you these options. So the options that we give them is that they could see their baby after it's born. Yes, seeing a dead baby is very shocking to anyone that you mention it to, even a parent who's going through it, especially a parent who's going through it. It sounds very morbid. It sounds very strange to anyone. It sounds very strange probably for me saying this to some of you. But we have viewings for adults that die, and, children and adults and whatever who dies, to make the loss a reality and to say that final goodbye kind of face to face. And I say to them, it's not a dead baby. It's your baby. And you wanted to see this baby. For months you've been saying, geez, I wonder what she looks like, or I wonder, if he's going to look like my husband, or if she looks like me, or, whatever. You've been dying to see this baby, and now, it's your baby. So, you love your baby, and it's normal to want to see your baby. And it's okay if you can't see your baby. But we give we want to give you the option to do all of this that we can. And everyone's afraid. What does a baby that's died look like? And I'll tell them, and most of the nurses will tell them as well. Listen, when the baby's born, normally we take any baby over to the side a little bit and we just wipe them off and kind of dry them off. And the nurse can tell you what your baby looks like. And, babies can look a variety of ways after they've passed away. they can look pink sometimes. Sometimes they have purple lips. Sometimes their skin is a little peely. So we never want any parent to feel like, shocked and afraid. We never want it to be traumatic. Like I said, we want it to, take out as much trauma as we can. So we say to them, listen, they have a little bit of peeling on their arms, or their lips are a little purple, but, this is what they look like. And kind of easing them into it makes it better for them. If they choose to see their baby, they can hold their baby. They can hold their baby as long as they need to. We have a little bed that we can put them in. We have a little bed called a cuddle cot. That's actually like a cooling bed that they can spend an extended period of time, a day or two, with their baby if they need to. I say take as much time as you need, whether it's you can only do it for 20 minutes or if you can do it for 2 days. It's totally up to you. You can dress your baby. We try to let the parents be parents, because they, this whole thing is so strange, and they lost that ability to be a parent to this baby. So if possible, with the baby's condition of their skin and whatnot, sometimes we will let them bathe the babies. Sometimes we'll let them dress the babies, and some parents are very hesitant, and sometimes we'll dress them for them. We have a program at our hospital, and many hospitals do. We have a program where we have seamstresses who make little gowns that kind of open in the back and whatnot, out of wedding dresses. And we can kind of slip them on them very easily. And it's just a more beautiful presentation to see your baby dressed in something. And then the parents get to keep anything that touches their baby. So they get to keep the little gown. They get to keep, we have tons of blankets and hats that wonderful volunteers make for us. And they get to keep the blanket and hat, the little measuring tape we measure them with. Anything that touches them, we do footprints. If they have a lot of hair, we'll take maybe a little lock of hair off the back, just to give them a little lock of hair if they want. We take pictures. We do our best to take pictures. We've gotten better through the years, certainly a lot better through the years. But there is an organization out there called Now I Lay Me Down to Sleep, and it's actually an organization who takes professional pictures. These are all professional photographers who volunteer their time to work for this organization, or some do it on their own, to take pictures of these babies and families, to have family pictures. We've taken pictures of babies for years, but never thought to take a picture of the mom holding the baby. I wish I had a picture of me holding my baby. I don't remember holding my baby. They do. When they start talking about it, they do remember it, but, it's not that fresh memory that you freshly have and that fresh feeling that you had. So to have those pictures is very memorable. So Now I Lay Me Down to Sleep does them in black and white. They Photoshop them to make them, a lot more forgiving. They take out any peeling or discolorations or whatnot, and they do a beautiful, beautiful, memorable job. But if they're not available, we do the best we can. At our hospital, we'll do the pictures. We'll print out a few, and we'll give the rest on like a memory card that they can keep, and they can do pictures themselves, and they can make their own albums, or they can do whatever they want to do with them. They don't have to look at them if they're on the memory card until they're ready. We give them a memory box, to hold all their things in. Just a little like shoebox, or something, around the size of a shoebox, with sometimes some sayings, some paintings, some stickers, different things on them, to also keep those precious possessions in.